Are you doing calf raises in your regular program? Well, that's great. But I'm telling you right now, if you're missing this muscle, which is called the soleus, you may be at risk of some major injuries. Let me explain what those are. So there's two muscles that I want you to be aware of, especially if you're over 40 like me, that are below the knee. Number one is the calf. We all know what the calf is. It raises you up this way. Very simple. The most important muscle that I think is forgotten often is actually the soleus. If you take this muscle right here, which is the calf, off of my leg, underneath it right here and all the way up to here is the soleus. The most important point of strengthening the soleus is the soleus and the calf both become the Achilles tendon, which is right down here. And the job of the soleus is to elevate you this way when your knee is in a bent position. So if you're only doing calf raises and you're going straight up and down, you're missing the soleus. We have to make sure the soleus has ability to lengthen while you're in a bent knee position and have the ability to contract and push off this way, because if it's not strong, you can end up with Achilles tendonitis, which is a lot of pain runners get through here, and you can even end up with Achilles ruptures. If you've had an Achilles rupture, you know this is a major injury that often requires surgery, and it's going to take you out of action for sometimes a full year. And the most common way that people tear their Achilles tendon is when they plant going backwards, or they go to the side, they bend their knee and they go to push off. When they're playing tennis or basketball, they feel a pop, they feel pain. Most people will look behind and say, who kicked me? It's a very common symptom, and somebody didn't kick them. What happened is that Achilles tendon snapped because of two reasons. It was weak and it wasn't used to stretching while the knee was in this bent position. So let me go ahead and show you the best ways to strengthen the soleus so you can prevent those injuries and not have to worry about pain in that area. So what I like to do in my lower leg routine is basically this. I like to basically do standing calf raises with my knees locked out like this. Now, the reason we want the knees locked out is because the calf muscle crosses the knee joint and attaches about right here, and it actually assists the hamstrings in bending the knee. So if you want to stretch the top portion of the calf and the bottom portion where it goes into the Achilles, you have to have your knees in an extended position. So I do double movements like this, spending time at the bottom here to make sure I get a good stretch. And I try to cadence it 1, 2, 3, 1, 2, 3, 4 with a 2-second hold at the bottom. Once I start to feel fatigue, I go into a single leg and I do the same cadence. 1, 2 at the bottom, 1, 2, 3. I push through the big toe because that's your main driver of this motion. And then I go 1, 2, 3, 4, feeling a good stretch. Once I fatigue here, I do the same thing on the other side. Now that's not enough because that's just calf muscle strengthening. To get the soleus, remember the job of the soleus is to raise you up this way and go into what we call plantar flexion while the knee is bent, because the soleus doesn't cross the knee joint. The soleus attaches right up through here on the back of the leg. So what I do for my soleus work is I bend my knees a little bit above 90 degrees, and then I push my big toe in, I raise up, and I do the same cadence. 1, 2, 3, 4 down, hold for a 2 count, 1, 2, 3. I go until I'm tired, and then I do a single leg at the same cadence. Bend the knee, 1, 2, 3, 4, hold for 2 seconds, 1, 2, 3. Pushing through the big toe. I do that until I'm tired, and then I switch legs. Now, what you want to think about doing is 2 to 3 sets of each of those movements until you're tired, really aiming for higher repetitions, 20, 25, even 30 repetitions, because you use those muscles a lot and you don't want to train them just to do small amounts of reps like 8 to 10. Now, the other key is that 2 seconds at the bottom. When you are at the bottom here, you are training your brain and the tissue to get used to being into a lengthened position and then pushing out of it. Because if you remember what I said before, if you're playing sports and you step down and drop that knee down to explode out of a movement, the tissue has to be used to getting into a lengthened position and then being able to contract to push off. That is my number one favorite exercise for the soleus. Let me show you my second favorite exercise. So if you have a gym gym that has a seated calf raise machine, awesome. Do that. My gym that I work out at when I'm not in my own office gym here has a seated machine, and I do that once to twice a week. Now, if you don't have that and you just have a home gym, take something like a plate so you can get into that deep stretch position and then put something heavy onto your knees because you need that resistance. Now, we're going to do the exact same thing we did standing. You're going to start in a stretch position, push your big toe in, start in what we call dorsiflexion or a stretched position, push your big toe in, raise up, hold, and then 1, 2, 3, 4 down, holding for 2 seconds at the bottom. Again, to get that Achilles tendon and soleus used to lengthening and then pushing out of it. And you can see here, if you look at the muscle in my leg, you can see more of a contraction right here in the soleus muscle. That's really its job, is to plantar flex or push down this way while the calf is working a little bit, but you can see it's more flaccid and the soleus is doing the majority of the work because the knee's in a bent position. So we're going to do as many reps as it takes to get tired. And then as you're fatigued, what I want you to do is push more into your left foot because you can't really raise this up very efficiently. I guess you can, but I keep this foot down for stability. And I think 90% of the work on this side, only 10 here for balance. So let's say I've done 20 reps doing both legs at the same time. Now what I'll do is I'll add that 90% load on this side and I'll push through that left big toe, lower down with the same cadence. 1, 2, 3 up, 1, 2, 3, 4 down, hold for 2 seconds. I'll try to get as many reps as I can until this completely fatigues out, and then I'll do 90% on the right side. Same thing, 1, 2, 3 up, 1, 2, 3, 4 down with a 2-second hold at the bottom. Once that's fatigued, I will rest and I will repeat. So there you go, 2 really great exercises to work that forgotten soleus muscle so you can prevent Achilles tendonitis, even plantar fasciitis, which is foot pain, and obviously try to prevent those catastrophic injuries that can really take you out of the game for more than a year, like an Achilles tear or rupture. So remember, don't just work the calf, work that soleus so you can strengthen the whole system, so you can keep on moving and most importantly, get better, not older.